My name is Ritu Singh, and I, as Chairperson, SRA International Committee, heartily welcome you all in today's webinar on mental health and well-being of adolescents around the world during COVID-19. The COVID-19 pandemic has led to significant changes in the lives of adolescents around the world as a result of stay-at-home orders, social distancing guidelines, and school systems opting for virtual instruction and learning. These changes have influenced learning, peer relationships, as well as family relationships, leading to stress and mental health challenges such as anxiety and depression. In this webinar, we bring together research related to mental health of adolescents during the pandemic, COVID-19, from 4 continents, Africa, Asia, Europe, and South America. We have 4 eminent speakers with us today to share and enrich us with their knowledge and experience. First, we would be listening to Dr. Suzanne Branje. She is a professor at the Division of Youth and Family of Utrecht University. Her work focuses on understanding the developmental changes in adolescents' relationships with parents, siblings, friends, and romantic partners, and the associations with adolescent personality, identity, and adjustment. Second presenter with us today is Dr. Lucía Magis. She is a cross-cultural developmental scientist at the Institute of Human Development at UC Berkeley. She leads Transitions, a researcher-practitioner partnership, which includes a large-scale, culturally and developmentally informed school intervention to foster digital citizenship for youth in Peru and Mexico. After her, we shall listen to Dr. Eurpe Yu. He is a research scientist from the Center for Research in Child Development, Nanyang Technological University. He received his PhD from the Human Development Department of Cornell University and worked as a postdoc at Rutgers University, New York, before moving to Singapore. Then, at last, we have with us Dr. Harry Obi. He is a professor of clinical forensic psychology and fellow of the Nigerian Psychological Association. He is currently the director of the Counseling and Career Development Center at the Nnamdi Azikiwe University, Waka, Nigeria. Next slide. Next. But before we get started, I would like to share few housekeeping items with all the attendees for smooth participation in today's webinar. First, all mics are muted for us to have best experience without any interruption or distraction. Secondly, attendees should use the Q&A function to ask questions throughout the webinar discussion. They can upvote questions in the Q&A box that they want answered earlier and use the chat function if they have any technical issues. Besides this, if attendees want to live tweet this webinar, they can use #SRACovid19. So now here we go. Let's listen to Dr. Suzanne Branje.
Welcome everybody, and thank you for inviting me to present in the webinar on mental health and well-being of adolescents around the world during COVID-19. In my presentation, I will focus on the mental health and well-being of adolescents in Europe. Since the beginning of 2020, the COVID pandemic has had a major impact in Europe. Since the fall, the numbers of infections have been rising quite fast again, resulting in a reinstalling of lockdown measures and restriction measures by most governments. The COVID pandemic has had a major impact on individuals' lives. Many people are concerned about becoming ill or about their relatives and friends becoming ill. And also, the daily lives of families has changed drastically. Adults often have to work from home, and children also had to follow school from home, especially during the first lockdown, where many schools were closed. So families spent more time together. Also, many structured leisure activities were cancelled, and adolescents had less abilities to see their friends. And often, if they saw their friends, it was using social media. These changes due to the COVID pandemic lead many to worry about the mental health of adolescents during this period. Many researchers and policymakers warn about the dramatic impact that COVID might have on the mental health of adolescents. Evidence so far is limited, however. There aren't many studies that report on the functioning of adolescents during the COVID pandemic. Most of the studies so far report on current functioning assessed with cross-sectional data. Some studies report on changing functioning but use self-reported data measured at one point in time, using retrospective reports. Only a handful of studies have compared functioning assessed before and during COVID-19. And there aren't really studies that also use control groups to really control for normative developmental patterns. So it's important to provide a nuanced and balanced view of the experiences and mental health of adolescents during COVID-19. Many adolescents might also experience positive issues, like decreased stress, when not having to do so much for school, or more time for relaxation, with chatting with friends or gaming. They might experience better sleep because they don't have to get up so early in the morning, and they might experience more intense and pleasant family life because parents don't have to balance work and family life so much. A qualitative study among Portuguese adolescents confirmed this. When these adolescents were asked to describe the impact of COVID-19 on their daily lives, they listed quite some negative things, like physical symptoms, increased headaches and muscle pain, lower well-being, absence of routine, less financial capacity, depression, anxiety and loneliness, lesser contacts with other people, more family discussions. But at the same time, they also reported a lot of positive things. Happier times with schools closed and online classes, more time for pleasurable activities, more time for physical exercise, personal growth, more relaxation, less tiredness, better and deeper friendships. So adolescents really saw a mixture of effects in their daily life. To understand the impact of COVID-19 on adolescent mental health, we need to take into account the different periods of COVID-19, especially given its long-term nature. And we also need to take into account the specific lockdown and restriction measures during the different periods within COVID. At first, people might feel alarmed and stressed. After some time, there might be adaptation. And after even more time, people might get exhausted and tired of the pandemic. Most European studies so far have studied the effect of COVID-19 on adolescents' mental health during the early phases of the pandemic. This study, for example, is a longitudinal study among Italian emerging adults across the first 4 weeks of the COVID pandemic. The results show that especially internalizing symptoms seem to increase during these first 4 weeks. Both anxious depressed symptoms and withdrawal symptoms increased drastically. Externalizing symptoms also increased a little bit, like aggressive behavior and rule-breaking behavior, but they didn't reach the high levels at internalizing symptoms. Another example comes from this study from Poland and among more than 7,000 university students. In this study, students participated in 5 cross-sectional waves during the first months of COVID-19. Although the line sometimes suggests that there is more change, only the change in depressive symptoms was significant across these first periods. Depressive symptoms were higher during the 3rd, 4th and 5th assessments, in which the lockdown measures were more strict than during the first assessments. Although these results suggest that particularly internalizing problems increase during the COVID pandemic, not all studies confirm these findings. In a study in the UK, among more than 7,000 mothers who were assessed monthly between March and October, very little change in functioning of adolescents was found. Behavioral difficulties were quite stable across the months of the pandemic and seemed to decrease a little bit in August, September. Emotional difficulties decreased a little bit at the beginning of the pandemic, but were quite stable thereafter, and restlessness and attentional difficulties were also quite stable, with a little bit of increase during the summer. For primary school children, More pronounced changes were found, particularly for behavioral difficulties and restlessness and attentional difficulties, with increases during the first months and decreases thereafter. The effects of COVID-19 on the mental health of adolescents might very well depend on their coping behaviors. A study among almost 1,500 parents of Italian, Spanish, and Portuguese children and adolescents with an average age of 9 examines the role of coping in anxiety, depression, and sleep problems during COVID-19. The results show that task-oriented coping and avoidance-oriented coping strategies were related to less anxiety, depression, and sleep problems. Task-oriented coping concerns making jokes, talking about the COVID pandemic, and accepting the pandemic as a fact, and avoidance-oriented coping strategies involve ignoring the pandemic and trying to live your life as much as normal. Emotional-oriented coping strategies, on the other hand, which consist of seeking support and talking about negative emotions due to the pandemic, were related to more anxiety, depression, and sleep problems. Only a handful of studies have examined changes in adolescent functioning and mental health from before to during COVID-19. One of these examples is a study among a small group of Dutch adolescents using a daily diary design. In this daily diary study, adolescents reported about their positive and negative effects a year before the pandemic and during the pandemic. No changes in negative and positive effects were found for adolescents, although the parents who also participated in the study reported increased negative effects during COVID as compared to before. Another longitudinal study among 151 Dutch adolescents followed their internalizing problems and externalizing problems for several years before the COVID pandemic, up until the year that COVID pandemic was happening. This study shows the importance of studying changes due to COVID within the normative development of adolescents. As you can see, for internalizing problems during the COVID-19 pandemic were not significantly different from internalizing problems in any of the other years. However, the decline in internalizing problems that was initiated in the previous years seems to have come to a halt during COVID-19. For externalizing problems, the decline in externalizing problems seemed to continue during COVID-19. This study also addressed the role of children's perceived stress during lockdown, as not all adolescents might experience similar effects on mental health. And the results confirmed that externalizing behavior before the lockdown led to greater perceived stress during the lockdown, which further on predicted externalizing problems during the lockdown. A final study examined changes in psychological problems among adolescents in Spain of about 14 years of age. Parents reported about the psychological problems of their children before and during the COVID pandemic. Conduct problems, peer problems, and pro-social behavior problems increased from before to during the COVID pandemic. Emotional problems, however, seemed to decrease. The study also assessed several factors that related to relative differences in functioning during the COVID pandemic. Worse mental health was associated with unhealthy activities, worsening of relationships with parents and siblings, and dysfunctional parenting style. And better functioning was particularly predicted by online contact with friends and maintaining routines and activities in the family and, for example, with sports. Overall, COVID-19 might be a stressful context affecting adolescent mental health. COVID-19 has had a global impact on all our lives and functioning, and as such might impact mental health. However, there are important contextual and within cultural differences that might determine the exact effect that COVID has on mental health. Individual differences, such as age, stress experienced during the pandemic, or mental health before the pandemic, might be important factors to consider when examining mental health during the pandemic or thereafter. Especially adolescents with mental health problems before the pandemic might be at risk, as there are reports that show that their mental health problems have increased, and they have found difficulties to address the right kinds of care for their mental health problems during the pandemic. Also, they might experience problems returning back to normal life when the pandemic is over. Thank you for your attention. I'd now like to introduce Lucía Magis-Weinberg, University of California, Berkeley, with her research attention on Latin America.
I'm excited to present today our work on adolescent well-being in Peru during the crisis, especially highlighting the role of digital technologies as a social bridge. My name is Lucía Magis-Weinberg, and I'm a postdoctoral fellow at the Institute of Human Development at UC Berkeley. Just to give you a quick overview of what is happening in the region, it has become the hardest hit region in the world by COVID-19 pandemic. The region has now multiple economical crises. It's limited in progress on social indicators, and there were episodes of social unrest in 2019 before the pandemic, and again in 2020, including Peru, the country in which we do our research. These crises are compounded by a wide digital gap. Almost half the children in the region did not have internet access at home during 2020, curtailing important opportunities for education and connection. And these disparities in digital media are amplifying prevailing economic gaps, compounding gender inequalities and other inequalities during adolescence. Schooling is an area of particular attention in the region. Education is on hold for more than 137 million children and adolescents in the region. 18% of students are not receiving any form of education. And when feasible, quality distance learning is unequally distributed, we see that 3 in 4 children in private school are receiving quality distance learning, but only half of the children in public school are receiving so. And unfortunately, some children and adolescents, including girls, migrant children, children from indigenous communities, and children with disabilities, are at a high risk of dropping out of school completely. UNICEF just did a survey on youth in 9 regions in Latin America. These are slightly older youth from 13 to 29 years. And they found that 20% of them are reporting anxiety, 15% are reporting depression. Almost half report feeling less motivated to do their activities. And right now, in later stages of the pandemic, 30% do endorse that economic motives are a big reason behind their upset. Just to zoom in on Peru a bit more, Peru did respond with the most drastic measures in the region in Latin America, including a very stringent stay-at-home orders for the first 100 days. The army was patrolling the streets. People really could not leave home. Adolescents could not meet friends in the parks. Children from separated families could not see the other parent, for example. And even despite these very stringent measures, Peru within the region has been one of the worst hit countries, sadly due to many structural inequalities in the system. Before it all started, I was already working in the Transitions project here at UC Berkeley. We have a researcher-practitioner collaboration between us, Innova Schools in Peru and Mexico, and Common Sense Education. And we have been working together since 2018 to really understand adolescent digital media use and well-being. And having this existing partnership allowed us to collect data at large scale early on in the pandemic, and we also developed an intervention to try to promote youth well-being. Just to describe our population in a bit more detail, we work with over 10,000 adolescents. They're all students of Innova schools who come from low and middle income settings. They're all urban youth in cities all across the country. And we're very lucky to work with this big and diverse sample, but I should note that it is not representative of the country. These students have certain privileges, they're slightly higher SES, and they're definitely much more digitally connected than other students in Peru. We collected data in April and May 2020, which corresponds to their week 6 and 11 of lockdown, and then again in November 2020. And just to give you a quick sense of the timeline, we collected these measures in April 2020 on anxiety, depression, loneliness, and life satisfaction. And then we did 2 follow-up measures And in the middle, we also measured several covariates, including resilience, social support, connectedness, and many aspects of their digital lives that I'll be talking about in the next slides. You can see the grade distribution, and by gender, 60% of our sample is female. And in the research questions I'll present in the next slides, we took subsamples of these 10,000 students. So we're working with around 1,000 students per question. All the information I'm presenting today is youth reported, and we collected data online using Qualtrics. The results I'm presenting today correspond to the early stages of the lockdown. In April, May 2020, we unfortunately documented a 25% increase in anxiety and a 40% increase in depression compared to data we had in the same sample before COVID. Loneliness seems quite stable. We didn't see an increase compared to reports in other pre-COVID samples. We see that older adolescents, particularly female older adolescents, are the ones reporting more distress in many of our indicators. And interestingly, in the early stages of the pandemic in this population, the biggest source of distress had to do with schools and friends. The disruption of routines, increased schoolwork was an important source of stress for the students. And 3/4 of them reported that missing their school, classmates, and friends was their biggest concern at the time. I'm curious to see what will happen in the data we've collected since. Physical distance is affecting social relationships for all grades. Here I'm presenting data for different types of relationships from 6th to 11th grade. We find that distance is negatively impacting relationships, particularly with friends, but also with peers. Of course, for older adolescents, romantic relationships are also strained. And as I mentioned at first, the lockdown measures were so strict that children and adolescents who came from households with separated parents could not see the parent who lived outside of the home. So that was a big source of concern. But definitely one of the silver linings is that this increased time with family is perceived definitely as the most positive outcome of the pandemic for the majority of adolescents. Anxiety and depression exhibit different patterns. This is work that I've done in collaboration with Victoria Wesley-Williamson from University of Oregon. We investigated how gender affected the trajectories. So for example, here I show you anxiety. At week 6 and week 11, we see that it's decreasing for males, but it's fairly stable for females, with a similar pattern with depression, where we see that depression is stable for males, but increasing for females. We report in general that women endorse more severe mental health symptoms than men, and older adolescents are endorsing more symptoms than younger adolescents. We looked at this data and saw we measure socio-ecological resilience in this sample, a measure that can distinguish between intra and interpersonal sources of resilience, as well as caregiver sources of resilience. And we find overall that parents still matter during adolescence. Caregiver resilience tempers an increase in anxiety for adolescents. We find that women are reporting higher levels of personal resilience, but overall we don't find big gender or grade differences in these different sources of resilience. And interestingly, when we include both in the model, it's really caregiver resilience, which is moderating the change, particularly in anxiety, with the message that caregivers do continue to protect against anxiety during adolescence. We sometimes forget parents when we talk about adolescents, but they're still very, very important. And as I said, we were really interested in the role of digital technology. We find that adolescents are communicating through multiple platforms. Here we ask them what they use to talk to friends. I highlight how older adolescents here are using more social media than younger students. For social media, for WhatsApp, a very popular tool in Latin America, for Facebook Messenger, and really highlighting how video game chats have become so important for younger adolescents, especially for boys, to communicate during this time. We were particularly interested to see the impact of online experiences on loneliness. This is work that I have done in collaboration with Christopher Geis, our lab manager, and we measured again loneliness at week 6 and week 11, finding very stable patterns. As you can see, males did have lower loneliness scores than females. We didn't find any great differences in the loneliness measures, but we were particularly interested to see the role of online experience. So in the same data, we find that positive online experiences are alleviating loneliness. Of course, screen time increased during lockdown, and this increase in screen time is associated with an increase in both positive and negative online experiences. I think this is an important message for parents and educators who sometimes worry too much about screen time. Older students had higher positive and negative online experiences, and the positive experiences really helped to alleviate loneliness. So here you see loneliness again at week 6 and week 11. And you can see here in the top, we have students who reported lower online positive experiences, and they have higher loneliness scores. And the opposite is found for those students who endorse higher positive online experiences. So really highlighting how positive online experiences are a source of social support, even when controlling for in-person family support, that can really help during this time. And lastly, alongside Estelle Berger, we explored a different question on autonomy and lockdown. We know that this lockdown has really curbed adolescent opportunities to realize autonomy, competence, and relatedness, amongst many other tasks. But we wonder whether engagement in online spaces could help mitigate the lockdown's negative effects on autonomy. Unfortunately, we are finding that online autonomy does not compensate for lack of offline autonomy. Females reported less autonomy online and offline. We do see here in the graph that older grades reported higher autonomy both online and offline. But unfortunately, it was only higher offline autonomy, but not online autonomy, that was associated with lower internalizing scores. To conclude, adolescents in Latin America are facing many challenges during this pandemic, including increases in mental health problems. We found that digital media can help adolescents satisfy certain needs and developmental tasks during the lockdown, but they're definitely not a panacea. Our findings also underscore the importance of caregivers for adolescents at this time. And I really want to close by underscoring the importance of integral solutions to respond to the needs of children and adolescents in Latin America, a region where many crises are putting young people at risk. I want to thank the team that makes this work possible. Thank you for your attention. And I lastly want to introduce Dr. Yu from the Nanyang Technological University, Singapore.
Hi, everyone. My name is Yu, and I'm a research scientist from Nanyang Technological University. Today, I will be sharing with you about the survey we did in Singapore on the impact of COVID-19 on the perceived mental health in Singaporean children and adolescents. The COVID-19 pandemic presents a significant challenge to the mental health of families and adolescents. The impact can come directly from the virus itself or from the indirect effects of school closures and lockdown measures. In this regard, Singapore provides an interesting case with a well-defined period of pandemic without lockdown measures, followed by a nationwide lockdown. So studying the case of Singapore may help examine some of the direct and indirect effects separately. The figure here shows a timeline of COVID-19 and related responses in Singapore. The orange bar is a period of local transmission before lockdown, roughly corresponding to February and March 2020. During that period, most measures from the government were precautionary, such as unwell persons to wear masks and social distancing. This contrasts with the red bar, which is referred to as a circuit breaker, roughly from April to May, when all schools and non-essential workplaces are closed, gathering are prohibited, and mask wearing is mandatory. Notably, if we look at the number of imported and community cases of COVID-19, which is shown in blue and purple bars on the figure, they are not significantly different from the pre-lockdown and lockdown phases. So the main difference between these two phases is lockdown measures. Taking advantage of this contrast, we designed the survey to collect retrospective self-report at 3 time points: pre-pandemic, which is January 2020, pre-lockdown, which is February and March 2020, and lockdown, which is April and May 2020. The data was collected in June 2020, so participants recalled what they felt during those 3 earlier time points. We focused on families with children under age 18, and each family filled out one survey. We are interested to study how family members' mental health and stressors change across time points, and whether it is affected by the family dynamics and daily activities. We collected complete responses from 198 families, including 505 adults and 235 children. Among these 235 children, there were 164 school-age children and adolescents between age of 7 and 18, which will be the focus of this talk. Overall, the sample resembles Singaporean population in ethnicity and education level, and the median monthly household income in the sample is slightly lower than the national median. We distributed the survey online for families to fill out. On the family level, we measured demographics, family composition, whether the family has received a quarantine order, and if any family member has been diagnosed with COVID-19. For each adult in the family, we measured job situation, monthly income, if they prefer more authoritative or authoritarian parenting values, how much time they spent on various daily activities, and also their mental health and major stressors. For mental health, we use a patient health questionnaire PHQ-4, which contains 2 questions on anxiety and 2 questions on depression. For each child in the family, we measured their daily activities, conflict, and closeness with other family members, mental health, which is also measured by PHQ-4, and major stressors. The bolded measures here are those that may change because of COVID-19, so we asked families to report for 3 time points: pre-pandemic, pre-lockdown, and lockdown. The other measures were only measured 1 time. For results, none of the families in our sample reported any family members being diagnosed with COVID-19. 7 adults and 6 children from 5 families have received a quarantine order or stay-at-home notice, and their mental health did not differ from others. Also, the household composition stayed the same for all but 6 families. For those 6 families, 2 welcomed newborn babies, and 4 families had adults moving out during COVID. However, there was a major shift in parents' job situation. Overall, more than half of parents who worked full-time outside home switched to mostly working from home during lockdown. In addition, number of parents who worked as full-time employee decreased significantly from pre-pandemic to lockdown. Here is a Sankey diagram that shows mothers' job changes during COVID-19. And this is a diagram for fathers' job changes. Monthly household income did not change from pre-pandemic to pre-lockdown, but decreased significantly from pre-lockdown to lockdown. Note that household income already included government subsidies in response to COVID-19, but on average, there is still a 7% decrease from pre-pandemic to lockdown, and 17% of the families suffered an income decrease of 30% or more. Because of school closures, the amount of time children spent in school decreased significantly, especially between pre-lockdown and lockdown. Additional childcare burden mostly fall on mothers, who on average spent 1 additional hour per day with their children during lockdown compared to pre-pandemic. Fathers and adult siblings also spend longer time with their children, while the amount of time grandparents and domestic helpers spent with children did not change. Perhaps because of spending longer time together, children had significantly more conflicts with their parents, and at the same time, they also reported to be closer with their mothers. For fathers, the change was not significant. In terms of everyday activities, children spent significantly less time outdoors during pre-lockdown compared to pre-pandemic, and during lockdown, their outdoor times decreased further. On the other hand, during lockdown, they spent significantly longer time on screen, both for learning and for fun. Before the pandemic, they spent about 3.2 hours on screen per day, and during lockdown, this increased to 5.6 hours. Notably, their social activities with friends did not decrease, potentially due to the use of social media. Children's mental health worsened because of COVID-19. When we look at the PHQ-4 score, which reflects anxiety and depression levels, it increased significantly from pre-pandemic to pre-lockdown and increased further from pre-lockdown to lockdown. The trend is similar for children between 7 and 12-year-old and for adolescents between 13 and 18 years old. When we look at individual emotions separately, children were more likely to feel anxious and depressed, as well as feel lonely, bored, and tired. In terms of COVID-related stressors, the top stressor children faced throughout this period was the amount of homework or home-based learning. The stressors which showed the sharpest increase in severity from pre-pandemic to lockdown were limited opportunities to socialize with friends and limited opportunities to travel or go outside. Children also experienced significant increases in stress from concerns about health and safety, as well as other stressors listed here. To examine whether the effect of COVID-19 on children's mental health can be partially explained by other factors, we ran a mixed effect model on children's PHQ-4 score across the 3 time points. Child and family were entered into the model as variables with random effects, and variables with fixed effects included time point, measurements for children, for parents, and for the family. For variables that were invariant across time point, we also included their interaction with time in the model. Results showed that factors that had a main effect on children's mental health included their time spent on digital devices and outside, their conflict with fathers, their parents' authoritarian values, their mother's mental health, and number of adults in the family. We then ran mediation analysis for these predictors. Because this is multi-level data within subject design, we use Bayesian multi-level mediation model, which is a bootstrapping method that suits the data structure. We first look at data from the pre-pandemic and pre-lockdown time points. So here, pandemic is the independent variable, and its effect on children's mental health is partially mediated by time spent outside and conflicts with father. And it is also fully mediated by mother's mental health. When we put all 3 mediators into one structure equation model, only mother's mental health partially explains the effect of pandemic on children's mental health. We then look at data from pre-lockdown and lockdown time points, and this time, only mother's mental health partially mediated the effects of lockdown on children's mental health. So in conclusion, we found that in Singapore, COVID-19 had a major impact on family dynamics, children's daily activities, and their social relationships. Mental health of Singaporean children and adolescents worsened from pre-pandemic to pre-lockdown and worsened further during lockdown. Changes in daily activities and family dynamics may partially explain the worsening of children's mental health, and mother's mental health may play an especially important role here. Okay, so I want to thank my collaborators, Yang Yang and Zhilin Chua. I want to thank all families who participated in the study and the funding agency. For more information, you can find our preprint paper on PsycArchive using the link or the QR code shown here. Thank you for your attention. Now, I'd like to introduce our next speaker, Professor Harry Obi-Nwosu from Nnamdi Azikiwe University in Nigeria. Sorry if I'm pronouncing that incorrectly, but thank you.
Thank you very much. My topic is mental health and well-being among adolescents in Nigeria during COVID-19 lockdown. Background. The index case of COVID-19 infection was announced in Nigeria on 27 February 2020. On the 9th day of March, the President of Nigeria inaugurated the Presidential Task Force on COVID-19 to work with the Nigeria Center for Disease Control in coordinating all activities towards containing the disease. The pandemic was reported to have spread to most parts of the country within the ensuing 2 weeks of the index case. Nigeria became locked down from 16th March to 30th June 2020. The government used law enforcement agencies and the military to enforce compliance to these lockdown orders, such that violators were either punished through mobile courts or by law enforcement personnel on the spot. Those adolescents were denied their normal energy expending and exploratory activities. They were forced to stay indoors with only family members, and in many cases under congested environments and poor economy. Meanwhile, the populace kept receiving gruesome information on the ravaging pandemic from across the globe. This unusual situation must have implications for health and well-being. Indeed, Observation and media reports showed increased domestic conflicts between parents and children, among other family members, and among neighbors. Cases of homicide were also reported. This scenario no doubt portends adverse psychological health conditions typified by depression, anxiety, and stress. Research has shown that these conditions, depression, anxiety, and stress, prelude, sustain, or complicate several adverse health conditions, as well as maladaptive behavior. Interestingly, however, some personal protective factors such as resilience, growth mindset, and intrapersonal peace could serve as buffers to these conditions. We therefore reasoned that assessing levels of these conditions, as well as factors as they relate to COVID-19 restriction period, past 2 months from time we took this data, could help policymakers understand the need to develop implementable holistic health and well-being policies in such situations. Accordingly, we sought to answer the following questions. 1. What levels of anxiety, depression, stress, and family conflict have adolescents experienced during COVID-19 lockdown? 2. What levels of personal buffer resources, that is growth mindset, intrapersonal peace, and resilience, do these adolescents possess at the time? And how do these variables correlate? To answer the questions, we collected data online from adolescents aged 14 to 19 years between 10th June and 1st July 2020 using the following 5 instruments: depression, anxiety, stress scale, conflict subscale of the self-report family environment inventory, growth mindset scale, UNIZIC resilience scale, the intrapersonal peace scale. Presented hereunder are descriptive statistical analysis and preliminary correlation results. Table 1 is the table of frequencies and percentages for depression. We can see from this table that 43% of the participants were normal, 15.9% exactly, had mild depression, 28.4% moderate, 8.1% severe, and 3.8% extremely severe depression. The bar chart is represented here. Frequency and percentages for anxiety is shown on table 2. From this table, 27.2% were normal, 17.5% had mild anxiety, 19.1% moderate anxiety, 17.2% severe anxiety, and 19.1% extremely severe anxiety. We have the bar chart presentation. Table 3 is the table of frequencies and percentages for stress. From this table, we see that 63.7% showed no stress or normal, 12.5% mild stress, 17.8% experienced moderate stress, 5.6% experienced severe stress, and 0.3% experienced extremely severe stress. The bar chart across gender is presented here. Table 5 is the table of frequencies and percentages for growth mindset across gender. From this, we see that 44.4% had growth mindset, that is positive. For the fixed mindset, we have 55.6%, which is not good. here we have the bar chart presentation. Table 6 is the table of frequencies and percentages for resilience. A total of 54.7% were high in resilience, while 45.3% of the participants were low in resilience. That is the bar chart presentation. Table 7 is table of frequencies and percentages for family conflict. From this table, 25.6% of the participants experienced low family conflict. 45%, as much as that, experienced moderate conflict. And 29.4% experienced high family conflict during the period. The bar chart presentation is here shown. Table 8 is table of frequencies and percentages for intrapersonal peace. 23.6% had low experience, 44.2% moderate intrapersonal peace, and 32.2% high intrapersonal peace, which is positive. That is the bar chart presentation here shown. Now the table of correlation coefficients among the variables. From this table of correlation coefficients, we can see that at both 0.00 and 0.05 levels of significance, there were significant correlations. That will explain. Resilience correlated negatively with depression, anxiety, and stress. Growth mindset correlated negatively with depression, anxiety, and stress. Intrapersonal peace correlated negatively with depression, anxiety, and stress. Also, family conflict correlated negatively with depression, anxiety, and stress. We must note, however, that since higher scores in the family conflict measure denote low report of conflict, the significant negative correlations between family conflict, depression, and stress is interpreted to mean that lower reports of depression and stress are related to lower family conflicts. Anxiety, stress, and depression have variously been implicated in many chronic health conditions, and more importantly, in lowered immune system efficiency. It follows that heightened and prolonged anxiety, stress, or depression could significantly predict prognosis among COVID-19 patients. Also, these psychological conditions have been implicated in addictive behavior as well as role performance levels, implying overall reduction in functionality and well-being. If lockdown did contribute to increase in the experience of these psychological conditions, then it must have contributed to poorer mental and physical health outcomes, as well as poorer prognosis for COVID-19 patients. We could infer that building up the personal protective factor The data presented above shows that a good number of the adolescents did not possess adequate levels of the buffer factors tested, which could explain the corresponding levels of psychological conditions experienced. Theoretically, this has significant implications for adolescent dropouts of school and apprenticeship programs, to restiveness, substance abuse and substance use, and to delinquency. Conclusion. The foregoing data and observations strongly suggest that lockdown complicated the outlook of COVID-19, that inadequate counseling and psychotherapy for victims and the general population must have contributed to increased mortality during COVID-19. However, we must accept this with caution, pending the comparison of current data with post-pandemic data. Thank you all for listening. We'd now like to open up for questions.
Thank you all the speakers for amazing sessions. You have very nicely presented scenario of mental health and well-being of adolescents around the world during COVID-19. I'm pretty sure that your presentations have given direction to many of us for possible areas of work with adolescents amid and post-COVID-19. Now let's address few questions we have from our attendees. First question is, it's actually not the question, comment from Sherry Bowman. I wonder if we will have access to the presentation after the webinar. There was so much excellent information and I'm unable to take notes quickly enough. I would like to answer on behalf that all these, the webinar is being recorded and after it's over, it's uploaded on the SRA website. So you can just use that uploaded recorded video. And the second question we have is from Millie Ward for UA. He has asked, have you taken into account the biases that are likely to be present in the retrospective recall of mental health symptoms? Evidence from studies using data collected both before and during the pandemic have shown that participants report experiencing lower levels of anxiety and depression before the pandemic than they actually did. So I would request UAA to answer him.
Hi, Millie. Thank you very much for that question. And I agree that using retrospective self-report data is a major limitation of this data set. And it is entirely possible that people may have memory errors and they may report lower levels of anxiety and depression before the pandemic. So the way we try to address that is, first, we try to give them a concrete time point to think about. So instead of saying like how much stress, how much anxiety and depression you feel before pandemic, we ask them about January 2020 and let them think about what they did during that period and how did they feel. And second, we are hoping to follow up with this sample when the impact of COVID is less, so to see if we can replicate some of the early the results from the early time points. Thank you.
He has answered his query very well. And if any more queries, the one more question, that is speakers' thoughts about commonalities across countries in terms of adolescents' responses. What are the speakers' thoughts on it? May I repeat the question?
No, maybe I can say something that I noted also when sort of trying to integrate the findings from Europe and also listening to the other speakers. One thing I noted that it seems that looking at adolescents, the effects on mental health seem to be stronger on the older adolescents compared to the younger. That was something that Lucía found. And that also if you look at the studies in Europe, the studies using older adolescents or university students found stronger effects than studies using younger adolescents. And maybe this is also related to that their lifespan, like expanding their sort of width of interactions from the family and peers they meet at school and online, to exploring the world and finding new friends and partners, etc. That might have a major impact. Maybe also starting a new life at college, which is made much more difficult nowadays than was before, or starting a working life. All these factors are now much more troubled and might affect the slightly older youth more than the younger ones.
Thank you so much, Suzanne, for answering this. Still, we are left with time if anyone wants to raise up any more questions for the speakers.
And if I may, I think another commonality that is emerging and that I see in US data and ours is the impact of distancing on peer relationships and friends. It is so important for adolescent functioning, and we know that very well. So it is not surprising that it is having such a detrimental impact, and that it's really what they report when we look at the qualitative answers. It is their biggest source of concern. And yeah, finding ways of promoting those continued relationships, whereas it's online or other ways, is very, very important. And another commonality that I think we're finding.
Thank you, Lucía. There's one more question for the speakers, that is for preventive interventions, what are some protective factors and processes that we can consider?
I would say that we need, especially we need tailored approaches. Like what I wanted to emphasize in my presentation also is that sometimes when you read the media, or sometimes also our own papers, we tend to exaggerate. I mean, research papers start with the detrimental effects of COVID on adolescents' mental health. And this is, of course, I don't want to underestimate the effects, but this is true for a small group and not for all adolescents. So I think we need to be careful with how we display the message. But I also think maybe like the high anxiety, but that is noted in Harry's results, might maybe not even relate so much to the actual impact of COVID, but much more to the high uncertainty about what COVID is and what it might entail. And that might be related to media displays that are not correct or providing not correct information. So providing good information, not exaggerating in our judgment, but at the same time, making sure that we target the right groups and the right populations that are at increased risks. I think that is really important.
Okay, there's one more question. Yeah, Lucía, please.
I think it's super important, speaking from Latin America and the data I've presented, we need to focus on finding ways of opening schools. It should be the #1 priority for children and adolescents. I understand the complexities this brings, but they're missing out on so much, and not only academically, but in terms of relationships and support. So finding ways, like in other regions in Europe, to bring is very important.
Okay, so since we are now, the time is up, so we need to wrap up here. And just last question, which I would like to raise on behalf of attendees is, one study noted that parents' anxiety increased. Any data on how parents' mental health is affecting kids?
Maybe I can speak about this. So in our data set, we do see an increase in parents' mental health issues as well. And then across time points, parents' mental health predicted children's mental health. So we did this in a mixed effect model where we have parental mental health and time point both entered as fixed effect variables, and especially mother's mental health predicted children's mental health, which speaks to kind of the previous question about how important family relationships are in terms of children's mental health, especially during this period.
Thank you, Dr. Yue. Since we are running short of time, Oh,
thank you very much. Thank you. And,
thank you.
In Nigeria, we also want to say that mental health of parents was affected because family conflict increased, and we even had records of violence, spousal violence. That shows that indeed mental health of parents were affected. Again, going back to what the colleague said, anxiety was very high, and indeed this anxiety might not have been as a result of COVID-19, but information. So I also subscribe to the fact that information, getting right information, not exaggerated information, basis like this is very important. Thank you.
Thank you so much, Dr. Harry, for addressing the question. Now, since we are running short of time, we wrap up here, and outstanding questions may be emailed to Jordan at jhack@sra.org, and she will connect you with the presenters. So, million thanks to our eminent speakers. You all have enlightened us with your work. Thanks to all attendees as well for joining us amid their busy schedule. Now we look forward to your joining us for our next webinar too, which is on tips for effective grant writing. It is scheduled on Jan 19, 2021 from 12 noon Eastern Time. See you all there. Thanks again to you all. Thanks.